Health Spotlight, presented by Community Health Network.
Now at 5:30, our Health Spotlight. So we're bringing in WISH TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Happy Wednesday, sir.
Happy Wednesday to you, Drew.
Thank you. I want to start with teens and social media. Many sites allow kids to join when they turn 13, but the current Surgeon General, as you know, Dr. Vivek Murthy, earlier this week said that's still too young. So how do we know when a child is ready for social media?
Well, great question. And I actually texted Dr. Murthy earlier. He's a big proponent of mental health and particularly youth mental health. And to answer your question, it's tough. 13 is not a magic number for phones or social media, just like 16 isn't a magic number for driving. But here are some things I want parents to think about. Your child should understand outcomes and consequences. They should know that when they post something online, it's going to be out there forever. And if they can't grasp that, they're not ready for social media. They should be mentally healthy. So if they're anxious or depressed, going on social media is not going to make that better. It's only going to make it worse. And then the third thing that's most important, Drew, quickly, is that you and your child need to be able to agree to open communication. If they're encountering an online predator or online bullying or inappropriate content, you need to have a relationship with them and an understanding that they're going to come to you and talk about it.
Certainly. I mean, there are social implications, but as you're pointing out, truly medical health reasons to think about this. Do you think there needs to be time limits on how long teens can use apps?
I absolutely think there should be time limits. We know that these apps, and Dr. Murthy pointed this out, are designed by some of the best programmers in the world to get you addicted. And the longer you're on it, the more it's pushing those dopamine receptors and causing you to become more and more reliant on being on social media. So parents can limit that addiction by limiting the amount of time young people have, particularly knowing that when you're teenagers, you're more prone to addiction.
Of course, being a father yourself, you have personal thoughts on this. What are your concerns about teens and social media?
Well, my biggest concern, and I have 3 teens, is that because of our culture, the access is already there. My 18, 17, and my 13-year-old have phones. They have access to social media. So the horse is out of the gate, and we're all just trying to figure out how to rein it back in. It's also hard when you've got multiple kids who expect equal treatment. My 13-year-old says, well, you're letting our 17-year-old do it. What about me? And I think that's why it's important that you sit down and you have a conversation with your children about the dangers of social media. Not to say you can't do it, but to say, here are my concerns. Let's figure out together how we can limit your chances of addiction, of bullying, and of other problems that can occur.
Helpful points. Okay, let's turn topics to COVID-19. President Biden announced he plans to end the COVID national and public health emergencies on May 11th. How will that impact our friend watching at home? What changes will they see?
Well, important for people to understand, the most important change is that the free stuff is going to go away. And when I say free stuff, free tests, free treatments, free masks, and potentially even free vaccines could go away when that emergency goes away, because that emergency allowed the federal government to pay for these things. But things folks might not think about. Under the emergency, we had a 7,000% increase in telehealth, and that allowed us to do many things in the mental health space, even to prescribe opioid treatment over the phone. Those authorities may go away. And there are countermeasures, medical countermeasures, that are available under emergency use authorization. What happens when that emergency authorization goes away? We've got to make sure these countermeasures can still be deployed if we see another surge coming again before or after May 11th.
Just a few seconds left. With that, do you think the timing of this move is appropriate?
I think the timing is right for us now to be planning. Who knows what's going to happen between now and May 11th? We could have another surge. So I don't like the idea of putting a hard and fast date out there. But I do think now is the time to say, okay, we need to start thinking about how and when we end this emergency while still giving people the tools they need to protect themselves.
Dr. Jerome Adams, we always appreciate your time.
Thank you, Drew.